Well, good morning, everybody. Welcome to the Lifeboat. I am AKA Heather Joy. Yeah, Tommy mentioned last night he wasn't feeling all that well, and yeah, he wasn't feeling very well last night. So you got me again. Anyway, hello to everybody. It's you know what? It looks to me like it's just you and Charlie. It's just you and I right now. Goodness. Anyway, switch this off. Oh, we've got JT here. Welcome. Okay. It's going to be a good day, guys. It's going to be a good day. I'm tired, though. And I got to go to work soon. It's going to be a good day. Uh, Before I get started, since I have, the intro clip that Tommy plays before every video. I have that on my computer, but I'm on my phone right now until I get a better internet installed. I'm just using the wireless stuff on my phone. So that's why I'm not playing it right now. So while you're on the lifeboat, please remember the 4 rules. We don't discuss politics, at least on this channel anyway. That's what Rumble's for. And it's all right to mention things like I couldn't have gotten through, you know, through my addiction without my faith, but saying things like my God is better than your God, please don't do that. Please refrain from cursing, and please remain from being mean. As Tommy always says, a lot of times we discuss things on this channel that are very sensitive, and people need to be protected. And so please refrain from making rude, mean comments. It's just not going to work here. And let's see, what was the other thing? Oh, if you look on this screen, I put the link there. If anybody needs to talk, you're welcome to jump on. You don't have to show your face if you don't want to. But if you do need to come on, that's basically like calling in. So yeah, just use that link that is right underneath me there. Anyway, full of hope, Paul M. Hunt. Hey, Hunt, I was worried about you yesterday. Are you doing all right? I hope you're feeling a little better. John, welcome. Who else? JT. Blue Dazzlebug Monk Searcher. Who else have we got? All right. Glad everybody's here. Okay, so I'm going to continue with what I had started the other day. I'm going to talk about opiates today. Opiate, comfortable here. Opiates are the natural form of analgesics that we get from the poppy. Opioids are the synthetic things, or the semi-synthetic things, like heroin is semi-synthetic. Things like fentanyl, tramadol, things like those are synthetic, but things like codeine, morphine, those are from the poppy, and that's that's why we call it that. And we've had opium for a very long time. I used to be able to purchase it, just walk into a chemist's or a pharmacy and just pick it up. Even at the turn of the century, you could get these bottles. I've seen these really old glass bottles with the label still on them, and you read through the ingredients, and there was like heroin and codeine and cannabis and all kinds of stuff. But I mean, it's always been an issue. There's always been an issue with opium addiction of some kind all through the ages. It's something that we do as humans. It can be very useful, when it's needed. And I'm very grateful to have it, both as a nurse and as a patient. When it's needed, it's very nice, but it is opioids, opiates, all of that. It's extremely addictive. Uh, I was just thinking, I remember when I was growing up, I lived right next door to my grandparents out on our farm, and my grandmother always had a bottle of laudanum in the cupboard and a bottle of paregoric in the fridge. I don't know if you older people like me, if you remember paregoric, but it's very strong. Trying to remember what kind of opiate was in it, but it was kind of strong, and it was very addictive. And so they would put this. Oh, what was it? Did they methylate it, or did they put something in it? So it just tasted horrendous. And just trying to get it down was. But if you were really sick, like if you had a bad case of the stomach flu or something, where you were throwing up and you had diarrhea, and you were going from both ends, that would stop it, but it was really hard to keep it down. But man, when you've got those abdominal cramps that are so bad, paregoric is very helpful. I don't think they even make it or prescribe it anymore. I don't think it's even around, but that was my first introduction as a kid to to opiates of any kind, was the paregoric in the grandma's fridge. Um, I was looking through the list of the most commonly prescribed opioids. And on the list, the top one was hydrocodone, and that would be like Vicodin, Lortab, Norco. That's hydrocodone. It's a combination of that and acetaminophen. Oxycodone. That's like what is an OxyContin, Percocet, Percodan. Um, that's what that one is. Oxymorphone is a strong one. The brand name for that is Opana. Of course, there's morphine, and where I worked, we always used to call it MS, morphine sulfate. But I've seen it called Cadian and Avanaz. Codeine, that's another popular one, like as in like Tylenol 2s, Tylenol 3s, Tylenol 4s, that kind of thing. You'll find it in a lot of cough medicines too. Along with promethazine. And I can't think of what is that called. I know that there's in Texas, it's a thing there where they use that cough medicine that's got the promethazine and the codeine in it, and they make it into a drink. It's kind of a social thing with music. I can't remember what it's called, but anyway, I mean, that's what they use. They get these big bottles of that stuff, and ugh, not good. um, of course, there's Fent. Sublimase is what I always knew what it was called when I was working at the hospital, but that was a while ago. There's hydromorphone. That's Dilaudid. Tapentadol, methadone, and tramadol. Those are, like I said, those are the most commonly prescribed painkillers. There's several ways that you can take them too. Of course, there's always, in a hospital setting, you can give those intravenously. There's shots, there's pills, transdermal patches. I mean, there's a lot of different ways of administering this medication. And I know, but purchasing it on the street illegally, a lot of times, you can buy pills and things, but usually, people are into an active addiction with heroin or fent or something. They end up smoking it or injecting it, and Anyway, let's see. Where do I want to take this? Okay. Let's talk about the side effects of opioids. Um, you're going to, if it's something that you are taking for a certain length of time, a couple of weeks, you're going to build a tolerance to it. If you're taking it every day, so it depends on what it's been prescribed for, but like for after a surgery or something, I know that I know a lot of people who have um, become dependent after surgery. Something they're trying to be very careful about now. And they're very, very doctors are very careful about what they put out. In fact, sorry, with my fibromyalgia, I have ended up going to the pain clinic that's here in town. Um, just opioids were my drug of choice when I was an active addiction. And so I ended up getting a lots of what are they called? Sorry guys, I'm very tired this morning. Anyway, lots of injections, like on trigger point injections. They put steroids, in different trigger points, like through my neck and back is where I have a lot of issues. And that's nice because that, helps control pain without me having to resort to some kind of narcotic again. That's just not not a good thing for me. That is definitely my drug of choice. Oh, and there was something I neglected to mention at first, but I have um, yeah, I'm sure I've told this before on this channel, but when I was 11, I was in a really awful accident, and I was addicted to the Demerol that they were giving me every couple of hours. It didn't take long for, because I found out very quickly that yes, it controls physical pain, but it also controls emotional pain. And I was, I just remember I felt wonderful, and it was like the answer to my prayers. Um, it doesn't last though, you end up with the tolerance and all of the different side effects, and yeah, not a good thing. um anyway, there was so much chaos going on in the home I was growing up in, and my parents were just fighting constantly, and there was just so much manipulation and abuse, emotional abuse. And I was an extremely sensitive kid, and um I was reading something, and I couldn't find the article. I saved it. I've got it here somewhere. But it was some research that was done that was talking about people that experienced um, something traumatic when they were growing up, childhood trauma. Um, it makes some kind of change. I don't know if it's neurochemical, or if it's structural in your brain, but it changes your brain, and it changes the way that you react to opiates. A lot of people, when say they end up in the ER, they're in a car wreck or something, and they're given some morphine or something like that in the ER, and they'll end up feeling dizzy and a little nauseated, and they don't like it. Yeah, it'll kill the pain, but a lot of people don't like it. But people that, anyway, in the research that I had been reading, it stated that people that have been through some kind of childhood trauma very often, when they are given some kind of opioid, um, experience euphoria and relaxation, and it's very different from the way that a lot of people experience that, and they like it. It can be a real problem. It does set you up, as it seems, for an addiction to opioids. I never know what to call it anymore, but you know what I'm talking about. But I found that very interesting. It explained a lot as to why I prefer opiates. um, anyway, when some of this, let's see. Well, hang on, let me jump over here for a minute. There are certain things, you're going to have side effects with any drug. Um, the first, with opiates, tolerance is going to happen, and it'll happen quickly, more quickly, depending on how often, how frequently you take it every day. But tolerance is definitely a problem with this drug. And your body is always your brain is constantly trying to maintain homeostasis, just trying to keep uh everything good. So when you are given this drug, and all of us, opiates will attach to the opiate receptors throughout your body, and when that happens, there's this release of dopamine, and you're before sorry guys, I'm struggling today. um as I said, your body's trying to maintain this homeostasis. So if there's a new chemical that comes into your body, and your body's trying to deal with it, and and if this chemical keeps showing up, your body adjusts things to deal with it, and that's why you end up building that tolerance. Your brain is just, I'm continually fascinated with the computer we have up here and how well it regulates our body despite the things that we do to it. It's rather amazing. But after you build a tolerance, if you are still taking opiates continuously, you're going to end up dependent on them. It happens. Another side effect is you will end up with an increased sensitivity to pain. You can, a lot of people experience nausea and vomiting when they take any kind of opioid. It'll give you a dry mouth, definitely, too. I remember that a lot. I had a dry mouth all the time. Constipation is a definite problem. Your body, when you eat and you swallow your food, ends up in your stomach, and then it continues to move throughout your GI tract, and you have all of this smooth muscle that lines your GI tract, and those smooth muscles, create peristalsis to move food through your gut. And that definitely, opioids definitely slow that peristalsis down. And when that happens, the fluid, the moisture that is in the fecal matter that ends up in your intestines, will be so absorbed back into the lining of your intestines. And that feces, once that moisture starts to leave, you got this nasty piece of fecal matter that's dry and hard, and it's going to be difficult to push out. It's definitely, constipation's a definite problem. And if you have abused opioids like I have, for a long period of time, trying to deal with constipation, even though I'm not on it, and it's been 15 years, it's a problem. There are some lasting effects from the abuse of these drugs. Sleep, of course, most people react to narcotics with, they get sleepy. My baby sister, though, has a paradoxical reaction to opioids, and it was crazy when she was a little girl. She ended up with, I think she was just like 2 or 3, just little tiny thing, and she ended up, I think it was this finger here. I'm flipping you guys off, sorry, but I think it was this finger, and it cut just the top of it off. She got it stuck in a library door at our church, and it was a really heavy door, and the poor little thing, it was just cut the top of her finger off. It was kind of dangling by one piece of skin. And it had happened right after I had been hurt. So they had taken her to the ER and they'd been able to reattach that finger. But then she ended up with this big chunk of scar tissue on her finger. And the plastic surgeon that I was seeing for all of the skin grafts that I had done, removed all that scar tissue off her finger. And I'll never forget, I was there in the office, that doctor's office, the day that they did my sister's finger, and they gave her an injection. I think it's just some Demerol, and to calm her down and to help her get a little sleepy so she wouldn't freak out while they were doing the procedure they were going to do on her. And she started to just yak. I mean, she was just talk, 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 and kind of bouncing off the walls. And I remember my mother and I looking at her like, what is going on? Yeah. Some people do have a paradoxical reaction to this drug, and they'll bounce off the walls. It's kind of funny. Anyway, it can make you sleepy. It can make you dizzy, create a lot of confusion. Another side effect of opioids is, in men, it lowers your testosterone levels. And, if you are abusing opioids long term, that can create some problems later on. Itching and sweating are also some of the side effects of opioids. And I remember I used to get very itchy, especially with the larger doses that I would take. Yeah, it make me very itchy. I don't remember sweating, but I remember being itchy. I was looking through some statistics and information about drug abuse, and I was reading things in my old nursing textbooks, and it was kind of interesting. It was stating, with people that purchase illegal drugs off the street, often, that'll be things like heroin or fent, but it's usually younger people, people that abuse the prescription medications, things that you get from a pharmacy. That way, it's usually older people that are a little older, middle class. But this is the frightening thing. Healthcare professionals, that is the largest population, of all the people that abuse opioids. Healthcare professionals are the largest population there. And that's a little scary. You know why? Well, it's, I remember, I was a nurse in a hospital. It was readily available there. You had access to it, and a lot of times, if you go into work as a nurse and you end up with a big patient load, it's extremely stressful, and you're worried about your own life and your own things that are going on at home. And then you got to go there and you got to deal with very ill people and their families. And you're dealing with other people's problems, basically. And it can be very stressful. It can push you, again, to want to be abusing narcotics. It also, healthcare workers too they work a lot of hours, a lot of long hours, and that interferes with your family life. It creates a lot of stress. So, it just being a healthcare worker, sometimes that can set you up for wanting to escape, wanting to abuse some kind of opioid. I wish I could tell you that I never worked when I was high. I can't tell you that, because I did. It makes you make very poor decisions when you are an addict, and I definitely did. And you think that you're so much better when you're high. You think that you can handle it, that you're different. You do. You tell yourself that you're different than everybody else, and you can handle this, and you'll be fine. And you justify it in your head why you're abusing these things. Anyway, yeah, I ended up getting into a lot of trouble, and for good reason, for taking things at work. I if I had patients that were prescribed pain medications, but they didn't use them, the records looked like the patient received um, their pain meds. Um, on paper it looked like it, but I just took them home. Yeah. Um, I'm very ashamed of some of the things that I have done. Yeah, but that's I think you guys understand. um, let's see here. Let me see. I'm just trying to read my notes here. Okay, the rate of opioid abuse is lower than other. Well, okay, I'm not. I have written here, the rate of opioid abuse is lower than other illegal drugs. I wonder if that's true now, though. Just with the explosion of fent in everything, I don't know. But anyway, so according to the information that I was reading, though, it was saying that, like I said, the rate of opioid abuse is lower than other illegal drugs, but anybody that is doing opioids, the higher levels of crime and violence are associated with opioids. Also, things like HIV infections, hepatitis infections, death, that occurs a great deal more with opioid abuse. And there's so many different ways you can you take this drug. I was talking about before, like there's fentanyl patches, transdermal patches is one way you can use this drug. There's intramuscular injections, IV injections, subcutaneous injections, which are very, that's the same thing as the way you give insulin, where you just put it into your subcutaneous layer of fat on your, under your skin. You can smoke it, you can snort it, sniff it, or you can take it orally. This is a very versatile class of medications. Anyway, when you take opioids, and they bind to those receptors, that's your brain is going to, well, not just your brain, but those receptors release dopamine, and of course that feels good. We like that. But let's see, it definitely causes your central nervous system depression. Definitely causes that. I'm sorry, just trying to read my notes here. Opiates have a major effect on your mesolimbic system, that pathway in your brain, that's your reward system. I mean, opiates for some reason really have a massive effect on that system. See. Anyway, the primary effects, when you take that, of course, you're going to have pain relief. You're going to, a lot of people will detach from their environment, kind of just focus in. It will decrease your respiratory rate. I was talking about how it'll decrease the peristalsis in your GI tract. Your pupils will constrict. And I know with IV use, a lot of times when it's first injected into your system, you for some reason with this class of medications, you feel it in your lower abdomen if it's if you receive it intravenously. I just thought that was interesting, and I remember that feeling. Euphoria is another effect you're going to have, and you might feel your skin warm. You feel some flushing. Um, Now, those are just the primary effects, but what are the signs and symptoms of opioid overdose? Um, those can be a little scary. Your people that have overdosed, first of all, their pupils will be just like tiny little pinpricks, and you will wonder, if they haven't lost consciousness, and you see how tiny their pupils can get, you wonder how they can even see. It's crazy. Um, Clammy skin is another good sign. Um, because it decreases your respiratory rate. People that have overdosed are going to have very shallow breathing, possibly irregular breathing. Their breathing, it can be very labored. They can even, and the respirations can even stop. With especially with fent being in almost everything that you get on the street now. Um, I'm sure that a lot of people will lose consciousness and quit breathing. Coma and death can, result if people aren't taken care of. Choking, gurgling, or snoring are also signs of an overdose. And apparently, I'm a snorer that way. I don't snore, but if the times that I overdosed, apparently I was quite the snorer. Another problem that can come with this is I don't know why I've written this here, but cross tolerance, where you will, because if you have been abusing opioids, your body, of course, becomes very tolerant to that. And other medications, other classes of medications, you might find that you have a tolerance automatically. That can be a problem sometimes. And rapid tolerance, getting tolerant quickly with opioids is very common. Um, of course, if you become dependent on opioids, and you cease to take them, you're going to experience withdrawals, and especially with prolonged heavy use, it's not going to be fun. Um, but if somebody has overdosed, um, they and it's they're losing consciousness, and they're not breathing enough, definitely needs some Narcan. And as you know, the scary thing is, the fent that is in the illegal stuff is in such high concentrations that there's just not enough Narcan. I believe Narcan, I had a box here of it. It used to be, I think each dose, the ones that you shoot up your nose, I used to be, I think, 2 milligrams, and the package that I have right now, each of them are 4. But I really think they should be making them a lot stronger, honestly. And I'm very irritated where I live. Every pharmacy that I checked, they don't give it without a prescription. And when I went to the doctor and asked for a prescription of Narcan, I had to explain why. They were looking at me like, why? And I'm thinking, why not? It kind of irritated me that I have to go, just hopefully to help, keep it on hand and possibly save somebody's life with it. I'm irritated that it's such a pain to get where I live, and they would only give me one box. There's 2 doses in it. And if I come across someone who's overdosed, I'm more than likely going to need more than two doses of that drug. But someone has overdosed. Narcan, in theory, will bring them around. If there's not, it depends on what they've taken and how much they've taken. But if you have enough Narcan, it's going to bring them around like that. And they're going to be dope sick. They're going to be miserable right away, and they're not going to be happy about it. Um, let's see. Um, okay, so what do you do? As far as when I was a nurse in the hospital, um, and people, I didn't work in the ER, but of course, I know what they do and how they treat it. Um, like I said, it depends on what they've taken. With if you have overdosed, like if you had a bottle of, say, Lortab, and you overdosed on those, more than likely, you have had to take quite a few of those, and they have acetaminophen with them. If you try to, well, guys, I tried to hang myself a few times in my past, and that's what I did one time. Was I think I drank an entire bottle of cough syrup, and I took an entire bottle of Lortab, and I think there was a drug called Darvocet N100s. They don't have it anymore, but it was a narcotic. And I think I had some of those in there too. And that, but anyway, with the Lortab and with the Darvocet, or no, what was it? I don't even remember anymore. But they had a lot of acetaminophen in them, and a lot of acetaminophen is going to completely ruin your liver. That can be very dangerous. And so if you've taken the stuff orally, and it's within, I think, 4 to 6 hours, then there is time to still save your liver. And they will put an NG tube, they'll put a tube up your nose, and it'll go, down the back of your throat, down, and they'll put it down into your stomach, and they'll wash your stomach out, basically, suck all of the drug and everything else out of there. And they call it gastric lavage. They'll wash it out, try to get that out of your system. But then they will also administer activated charcoal, and they'll put that down. They'll send that down the tube that's down your nose, so it goes down into your stomach. And the activated charcoal will help absorb all of the acetaminophen before it can damage your liver. It can kill you. The acetaminophen can kill you. It can be a really bad situation. If someone has taken the medications, intravenously, another route, and they come in to the ER, and they've overdosed, of course, they're going to get the Narcan as much as it takes to bring them around. But, depending on what they took, you might have to give the Narcan again, because the Narcan will leave your body. It'll be broken down and excreted out of your body before the opiate will. So that can be a problem. So you've really got to monitor the patients if they've overdosed. Yeah. And anyway, when you give someone Narcan, if it brings them around, as I said, they're going to be automatically start going through withdrawals. They're going to be dope sick, and it's not fun. What are the signs and symptoms of that? Of course, you're going to have the cravings again, and the cravings can just drive you crazy. Abdominal cramps, diarrhea, explosive diarrhea would be a good description of that one. Lots of nausea and vomiting. You get very watery eyes. Your pupils will dilate. They'll get big. I don't know why this one, and I've seen it, and I've experienced it too. Lots of yawning when you're going through withdrawals. You're going to feel a lot of pain. you have a lot of your large muscle groups, like your, especially the large muscles in your thighs. A lot of people will feel it there. A lot of pain, a lot of just muscle contractions, and it's miserable. You might be shaking. You have a lot of tremors. Um, and then you're going to go either between, you're going to have a fever, and then you're going to be shivering. You go back and forth. You're going to have a lot of diaphoresis. I'm sorry, sweating. It's miserable. All of you that have experienced opiate withdrawals know how miserable, absolutely miserable it is. It's, oh, and last weekend, I think I mentioned last time I had talked to all you guys, over the weekend, I was trying to go without gabapentin, and gabapentin, you'll go through withdrawals on that drug too. I've taken it for maybe 4 years now, every day, and it's kind of hard to get off of it. And the weekend, that was how I spent my weekend, was rather miserable. I was sick, lots of cramps, and just it wasn't fun. I was hot and cold and hot and cold, and it was, yeah. But yeah, it's pretty intense if you're going through withdrawals. And that's why, trying to get off of opiates can be so difficult. Um, you don't want to get dope sick. Let's see. Luckily we have these new medications. When I first became a nurse, methadone was the only medication that they had to treat opioid use disorder. I guess that's the term. Of course, but now we've got naltrexone, which is a drug that naltrexone works with alcohol abuse as well as opiate abuse. It removes the effects, the pleasant side effects that you get from taking it. You don't experience those with that drug. And of course, there's the buprenorphine, like the Suboxone or the Sublocade, Subutex. There's that one, and there's methadone. We've got some good options now to make it so that people can get off the off the opioids and not suffer. Because really, if you are withdrawing from opioids, suffering's a good way to describe it. Let's see here. I wanted to talk a little bit about the long-term side effects that you can experience from opioid abuse. There are some serious complications that can happen. HIV infection is a big problem with people that have to share needles. That can be a huge problem. And I was reading in, where was it? Maybe it was the CDC where I got this, but 55% of people, heterosexual people, that ended up getting HIV from a partner, in that partner got it from being a drug abuser, an opiate abuser. I thought it was kind of interesting. Hepatitis B and hepatitis C infections are two that you can receive because of this abuse as well. Those are viral infections, and if they aren't treated, you end up with liver damage, permanent liver damage, and that's not good. When your liver goes, you're in big trouble. Your liver helps digest and metabolize your food. It helps break down these medications. It does a lot of things besides that. Without your liver, you're going to die. It's a serious complication. There is in your kidneys, it can damage your kidneys. There are these are they called? Glomeruli, glomeruli in your kidneys. They're like your kidneys filters. Your kidneys help maintain the right fluid balance in your body. They help maintain your electrolytes and really important organs. And so if you end up with kidney damage, that's a big problem as well. But glomerulonephritis, where you end up with a bacterial infection and those glomeruli become inflamed, they're not going to work right. And that damage can end up being permanent. And that's not good either. Some of the other complications that you can end up with are, just there's so many health issues that you have. Most likely, if you've been, using and abusing for some time, you've neglected your health. You're not eating properly. You're not taking care of yourself the way that you should. And there are going to be, not sure what it's very individual, but there are going to be long-term health effects. And a lot of times too, and people that are using drugs intravenously end up with, these horrible infections where they'll have these horrible abscesses. My sister-in-law, she and I went to nursing school together our first year, and she works down in Gilbert, Arizona, at a large hospital there. And I know she ends up with a lot of patients that come from the prison. And they will have, she was just describing the horrible abscesses that they have. And I know a lot of IV drug users end up with that problem. And you've got to take care of those abscesses. Those are infections. They need to be taken care of because they can go systemic, and that can, if you're septic, if you've got an infection running through your body, through your blood system, that's very dangerous. And it can lead to that. Also, this does not happen very often, but it's happened to me. There's a synthetic opioid called tramadol. I'm trying to think of the other name for it, but it's a synthetic opioid that is given for pain. And I've abused it in the past. And one of the very unusual side effects of that one is ototoxicity. It doesn't happen very often from what I've read, but it damages, from what I understand, the opioids constrict the blood vessels around your cochlea, and that is damaged, or it can even damage your auditory nerve. But they call it ototoxicity. Auto meaning your ears, and I have to wear hearing aids now. I have a constant ringing in my ears that never goes away. When I get headaches, it gets really loud. Then there are certain medications that I take that make the ringing worse, but it's just something I have to learn to live with because it's not going away. And my hearing is getting progressively worse. Dang it. I forgot what I was going to say, but that is a possibility. But from what I read, that ototoxicity doesn't happen all that often, but it can happen. You can end up with permanent kidney damage as well, to the point where you're going to have to go in for dialysis, several times a week. So there can be some serious complications from this abuse. I think, as a nurse, taking care of people, I just never, I never worked in the ER, but I was, there were times when I worked there was a point where I worked in psychiatry for a while, and we would have to monitor people that had overdosed, but you just have to monitor them and watch them closely. But an overdose, with opiates, I don't think is as scary as, no, that's not what I'm sorry, guys. The withdrawals, that's what I was trying to say. The withdrawals and that part of it is not as dangerous and not as scary as benzodiazepines or alcohol. Those patients would scare me. You can feel, you can feel just horrible. This is probably one of the most horrible withdrawals to go through, but it isn't one of the most dangerous. If you've overdosed, once you're stable, and going through with the withdrawals, then yeah, that's not as scary, but it is the most miserable, from what I've seen and from what I've experienced. Luckily, we have those wonderful medications like the buprenorphine, methadone, then naltrexone, um, makes it possible for you to um, get on with your life. It's a good thing, and we're really lucky that we have those medications, because there are a lot of people that abuse opiates, and it's a difficult one. It's a definite problem, and it's a scary problem now. With fent being in so many things and so prominent, it's a problem. But anyway, let me just look at the chat here. Oh, wait, I got chat here too. Just want to see, are there any questions you guys have? I apologize. I'm just a little tired today. I don't think I did a very good job of explaining things, but I'm trying, guys. Let's see. Oh my goodness, we got all kinds of people here this morning. I don't see any questions. Anyway, whoops. Okay, guys. Well, that's about all that I had prepared for today. I know that, if you're still in active addiction right now, or if you're just, newly sober and trying to hang on to that sobriety, I just want to remind you guys, you're stronger than you think. You really are. You're stronger than you think. If your brain, as I said, is constantly just trying to keep homeostasis, and your brain likes the easiest thing. Um, so it's, your brain's gonna fight with you at first on this. It's going to want to keep things the way that they have been. If you've been using for a while, it's going to bug you to do what you routinely do. It's going to be a fight at first, but you really are. You are stronger than you think. You can do this. You really can. I know it's not easy. I know it's discouraging at times, and I know there are times that you get very depressed and very discouraged. It could be problems with family. There's just so many things, so many problems that addiction creates. I know it's not easy, but you can do it. I've been there. I've been there, and I know how much it hurts. I know how sick you can be at times. It's not living. It really is not living. But life is possible again, and it is possible to be happy, to have a productive life, to do the things that you enjoy doing again. It's possible to get your relationships back. It is. I know it's not easy, but I promise you it's doable. And I promise you, if you really want this, if you want that sobriety and you want your life back, you can do it. You can do this. And it's obvious you're here. You want the sobriety. Yeah. Anyway, I Tommy's not feeling so well today. But if you are struggling, reach out to someone on your list of 5. Reach out on the Facebook, the Lifeboat Facebook page. Let me put my email in chat too. If there's anyone who needs something today, you're welcome to email me and I will check. I never open my email, but I'll check today, guys. I promise. Let me put it here. Let's see. Which one should I use? Hang on here. Let's see. Oh no, I just erased it. Hang on. Let's see. What? Okay. Oh, try it one more time. Oh, good grief. This is not working. Okay, one more time. I apologize, guys. Okay, there we go. There it is. So, please, if anyone needs something, needs to talk, please reach out. There's my email, and I will be checking it today. But if you're struggling, reach out, because really it's I know I've said this countless times now, but if you're upset, you're struggling, you've got all of these thoughts back here where you're just experiencing your emotions. What you need to do is talk or write and talk about those emotions, put into words what you're feeling, what you're thinking, because that moves everything up to this part of your brain, the prefrontal cortex here. This is your adult brain. This is where you're rational. This is your thinking right here. And it will help pull things together. It's really important that you reach out to somebody and, like I said, talk or write. Both of them do that. And they help you to get control of those emotions. So, anyway, I hope you guys all have a really great day. Thank you for putting up with me this morning, and thank you for coming. I love the boat. Love this boat. I love you guys. I pray for you guys every day. Hang in there, okay? And I don't know, I might see you this evening. You might see Tommy, but somebody will be on. So we'll see you again later. You guys have a great day.